What is a normal audiogram really? Have you ever wondered what a normal audiogram really means? An audiogram is a visual representation of your hearing ability across different frequencies. It shows the softest sounds you can hear at various pitches. In clinical terms, normal hearing is often defined as having hearing thresholds of 25 decibels hearing level or better across the tested frequencies. Many health authorities consider thresholds between -10 decibels hearing level and 15 decibels hearing level as indicative of healthy hearing. This means that if your audiogram falls within this range, you can detect sounds at very low levels, close to the softest sounds the average person can hear. On an audiogram, frequency or pitch is plotted on the horizontal axis. This typically ranges from 250 Hz to 8,000 Hz, covering the frequencies most important for understanding speech. The vertical axis shows intensity, or loudness, measured in decibels hearing level. Lower values at the top representing softer sounds, while higher values at the bottom representing louder sounds. A normal audiogram will show threshold points near the top of the graph, indicating the ability to hear quiet sounds across various frequencies. It is important to note that normal hearing thresholds do not imply perfect hearing. Instead, they indicate hearing within a range considered typical for the general population without clinically significant hearing loss. Slight variations within this range are common and usually do not affect everyday hearing ability. The standard for what is considered normal hearing is based on statistical averages and clinical consensus rather than a strict biological limit. However, the concept of a normal audiogram has its limitations. Research analyzing large sets of audiograms has shown considerable variability in hearing thresholds among individuals, even among those classified as having normal hearing. Attempts to define standard audiograms for typical hearing loss patterns reveal that many audiograms do not fit neatly into predefined categories. This highlights that hearing sensitivity is highly individual and can vary due to factors like age and noise exposure. In practical terms, audiologists use the audiogram to identify deviations from this normal range. This helps in diagnosing hearing loss, its type, and severity. Thresholds above 25 decibels hearing level at any frequency usually indicate some degree of hearing loss, which can impact communication and may requiring intervention. In summary, a normal audiogram represents hearing thresholds within about -10 to 15 decibels hearing level across speech frequencies. It reflects the ability to hear soft sounds typical of a healthy auditory system. While it is a standardized tool essential for diagnosing hearing loss, it must be interpreted with consideration for individual variability and clinical context. Always consult a healthcare professional for personalized advice regarding your hearing health.